Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, pseudo-Foster-Kennedy syndrome. Number one, pseudo-Foster-Kennedy syndrome. Pseudo-Foster-Kennedy syndrome is seen in non-arteritic optic neuropathy, whereas we also have Foster-Kennedy syndrome. Actually, what is this Foster-Kennedy syndrome? In Foster-Kennedy syndrome, there is ipsilateral optic atrophy with contralateral papilledema. Ipsilateral optic atrophy with contralateral papilledema is called as Foster-Kennedy syndrome. It occurs due to the orbit surface of the frontal lobe tumor in the orbital surface of the frontal lobe or tumor in the olfactory groove and the pituitary body is the cause for this Foster-Kennedy syndrome.
thank you and thank you for watching.